Hi everyone, Dr. Mika here again. If you're new on this channel, welcome. Please click on the subscribe button if you have not already done that. Turn on your bell notification so that anytime I drop videos, you will be notified. Like and share this video, please subscribe. Today I'll be talking about neurotuberculosis or TB for short. It is estimated that about 2 billion people worldwide are infected with Mycobacterium tuberculosis, often known as TB for short. 2 billion is a ton of people, even though they are infected. Not all these people have symptoms. In fact, the vast majority, say about 90 to 95%, aren't even aware that they are infected with Mycobacterium tuberculosis. This is because the immune system is able to contain it such that it does not allow it to multiply and then spread, but remains on the latent phase or dormant phase, as opposed to the active phase that causes symptoms. You know, if the host immune system is dilapidated at some point, say in the case of an immunocompromised patient, a patient who has HIV and AIDS, their immune systems are usually low. Such patient, if at any point in time had been infected with Mycobacterium tuberculosis, it will reactivate and then spread throughout the body. Or in the case of an elderly patient who has once been infected with Mycobacterium tuberculosis as well, if the body immune system is low, it will reactivate as well and then spread to other location. That is the active phase of TB. Mycobacteria are interesting bunch. They are slender rod shape and requires oxygen to survive. In other words, they are aerobes. They have this waxy cell wall, which leads to the production of mycolic acid. But how does it transmit? Mycobacterial tuberculosis are transmitted via inhalation, which is how they gain entry into the lungs. We breathe in all sorts of viruses and bacteria all the time. But the good thing is that we've got immune system that helps to defend and fight back the infection. So how do you know when someone is positive for TB? Well, TB testing starts with purified protein derivative or PDD. There's also intradermal skin test, also known as tuberculin test. There's mantle test, simply known as TB test. Tuberculin is injected between the layers of the dermis. Tuberculin is a component of bacteria. If an individual had previously been exposed to TB, the immune system will react to the tuberculin, and it will cause a small localized area of reaction. This will happen between 48 to 72 hours. So if this area of large in duration is larger enough, rather than just redness, then it is considered to be positive test for TB. Tuberculin skin test simply means an individual or the patient has previously been exposed to TB. It does not differentiate the active and latent phase of the disease. An alternative to the tuberculin skin test is interferon gamma release assay or IGRA, where you check for evidence of previously exposed blood to TB protein. Treatment of latent TB involve using a single drug for a prolonged period of uh, time, say 9 months. You use isoniazid, single drug for 9 months if it's latent TB. But if it's the active phase of TB, there are a combination of anti-TB medication that are used. I will list them up here for you to see. Yeah, a quick recap. TB is caused by Mycobacterium tuberculosis and it affects the lungs. The body immune system to fight it by creating a granuloma. How do you know when someone has TB and what do you do? Testing for TB, you do a PDD test or a mantle test to check for TB. You do an X-ray to look for it. When you see the patient in the hospital, they have fever, they complain of night sweats, they have weight loss, they have hemoptysis. Okay, so you collect the sputum sample for culture. You do a PCR to look for Mycobacterium tuberculosis. The treatment for the latent phase, I told you, is a single drug, isoniazid. And for the active phase of TB, you have a combination of anti-TB medication, which I'll put up here for you to look at. Those are what you take for a period of 12 months for the treatment of TB. If you enjoyed this video, please click on the subscribe button, turn on your bell notification so that anytime I drop videos, you'll be notified. Like and share. Share these videos to some people. You never know who this video might help. You that you're watching me, go for TB test. You may have TB. You never know. Go for TB test and thank me later. See you in my next video. Atutale.